Thanks for joining this concurrent session. We've got three talks, or you guys are talking together, right? Yeah. Okay. So I'm going to let Jordan introduce herself in a second, but we also have Tristan Faust, is a registered environmental health specialist and microbiologist for the Eau Claire City County Health Department. She graduated from the University of Wisconsin-Eau Claire with an undergraduate degree in environmental public health. In 2023, she graduated from Oregon State University with a professional science master's degree in environmental sciences with a special focus in water resources. And they will be talking about blue-green algae blooms and public health issues in Wisconsin waters.
Thanks, Maddie. Hi, everyone. I'm Jordan Murray. I am the former harmful algal bloom program manager at the Wisconsin Department of Health Services, but recently took on a new position as a groundwater toxicologist at the DHS. So dealing with creating drinking water standards in Wisconsin and then helping the DNR assist local health departments with drinking water quality issues in their jurisdiction. So yeah, currently we are actually hiring for a harmful algal bloom program manager. So if you know of anyone interested or passionate about harmful algal bloom epidemiology, let them know that the state health department is hiring soon. So yeah, we'll be talking about harmful algal blooms and public health in Wisconsin. So diving right into what cyanobacteria are. So cyanobacteria, also known as blue-green algae, are a type of photosynthetic bacteria, meaning just like other plants and algae in the water, they get their energy from the sunlight. They are responsible for, or they're one of the first organisms that figured out how to create oxygen. And because of this, they are responsible for the creation of Earth's atmosphere and water bodies as we know them today. And they can be found in every river, stream, and lake in Wisconsin. So while in their natural state, they are not a hazard, under certain conditions, they can become a health hazard to humans, animals, and the environment. With enough sunlight and nutrient input into the water, they can grow and reproduce to form what are known as harmful algal blooms. And harmful algal blooms, otherwise known as HABs, can affect aquatic life and people and animals who use the water for recreational and occupational purposes. Here are some other examples of harmful algal blooms you might see in Wisconsin's water bodies. At the top left is a picture of a bloom. It kind of comes in the form of streaks or floating dots on the surface of the water. The bottom left is, you can see that blue pigment. When cyanobacterial cells die, they release this blue pigment. You can see it's kind of dried up on the shoreline. They also come in the form of floating globs or mats on the surface of the water. Then on the right is a classic example of harmful algal bloom, green pea soup water conditions. Some species of cyanobacteria that grow and form these blooms can produce toxins called cyanotoxins. The most common toxin that we see in Wisconsin's water bodies is a liver toxin called microcystin. Cyanotoxins affect most organs and body systems and can be harmful to human and animal health. They're usually categorized into 3 different groups. So hepatotoxins are liver toxins like microcystin. Neurotoxins affect the nervous system, and dermatotoxins affect skin health. There are a couple different ways that people and animals can become exposed to and get sick from cyanotoxins. Ingestion or swallowing water is the most common exposure route, as you can imagine, especially for children. And if you swallow some water with toxins in it, you might not be feeling so great a few hours later. You might experience that abdominal pain, nausea, diarrhea, or vomiting. Neurotoxic effects can also occur, dizziness, numb lips, tingling fingers and toes. I will say that these neurotoxic effects in humans are more common from exposure to toxins in marine water systems rather than freshwater. Ingestion of fish contaminated with HABs is another exposure route I want to mention. Fortunately, the health effects from this exposure route are not well known. Based on the research out there, the general consensus is that there's not really a health, or the health risk from short-term consumption is relatively low, but the health risk associated with long-term consumption or chronic exposure is just not well studied at this moment. But we do know that there have been no known reports of illness from eating fish caught during a bloom. And we also know that cyanotoxins are more likely to build up in the internal organs of the fish, like the liver and kidney, rather than the fillet or the muscle tissue. And because of this, we strongly encourage people to avoid consuming the internal organs of a fish if they know that it was caught during a bloom. This is a fact sheet that compiled the information I just talked about. It goes a little more in depth about fish consumption, consuming and catching fish from harmful algal bloom waters. Basically, it serves as a guide for safe fishing practices and safe fish consumption. So if you're interested in this resource, it's located on our website. Otherwise, I can send it to you directly. Inhalation is another exposure route. So cyanobacteria and cyanotoxins can become aerosolized through wave-breaking activities like jet skiing, boating, tubing through a bloom, or from strong winds. And if you breathe in water droplets that contain cyanotoxins in them, you might experience symptoms similar to a cold or flu or allergies. So things like itchy eyes, runny nose, sore throat, cough, congestion, those are some common symptoms. If you come into skin contact with algal scum, you might experience some rashes or hives, skin blisters, or red, irritated, itchy eyes are common symptoms. These are some examples of some of the rashes that have been reported to the state health department from people who had an exposure to a water body and developed a rash on their skin at some point afterwards. After very thorough investigations from the state health department, we actually determined that most of the rash reports that we receive are not HAB-related after all. And I included this slide really just to highlight the fact that rashes can be caused by a lot of different things, and HAB rashes often look similar to other kinds of rashes, making it very hard to diagnose them and classify them. There are some things that we do know about HAB rashes. We know that they are rare. We don't see very many HAB rashes here at the State Health Department. We don't get many reports of them. And if you look at the existing literature, exposure to freshwater harmful algal blooms don't typically elicit a skin reaction in healthy populations, so people without pre-existing diseases. We also know that these rashes are more commonly found where clothing is held tightly against the skin, so under waistbands or swimsuits. This is because cyanobacterial cells can get trapped between the skin and that article of clothing, and they can burst and they can release toxins, and the toxins can rub against your skin and can cause a rash. These rashes are also more common among people with skin sensitivities like eczema or dermatitis. We also see symptoms of HAB illness in animals. Typically, these symptoms are more severe because animals tend to ingest more water than humans do, and they're also relatively smaller in body size, meaning that it doesn't take much toxin to make them sick. Some of the most common symptoms we see in them are those gastrointestinal symptoms like the diarrhea and vomiting. We also see neurotoxic effects in our dogs. So things like seizures, muscle weakness, and paralysis are also pretty common. We've come to learn over the years that other illnesses often share similar symptoms as cyanotoxin poisoning. And because of that, they might initially be mistaken as a HAB-related illness. And these include illnesses like water intoxication, heat-related stress, pesticide exposure, and exposure to other types of poisonous substances like mushrooms, for example. As I sort of alluded to, confirming these illnesses are very, very hard to do, unfortunately. Most of the time, as I've talked about, the symptoms of HAB illnesses are very vague. They often sound like other illnesses. There isn't a single signature sign or symptom of a HAB illness that can clue us in. There's also a lack of general HAB knowledge among medical professionals, so doctors and veterinarians. And there's currently no commercially available diagnostic test that a doctor could run, for example, on a blood or urine sample to determine that your illness was in fact related to cyanotoxin exposure. But at the federal level, the CDC has recognized these challenges in diagnosing and confirming HAB illnesses. And because of this, they've recently launched a new biospecimen testing program where health departments can actually submit human and animal blood and urine samples to the CDC's lab to be analyzed for cyanotoxins. So there's definitely efforts at the federal level to improve illness surveillance for HABs and also improve toxin testing. So several state agencies in Wisconsin work together to manage and address bloom issues and illnesses that result from exposure to blooms. So unlike other states, Wisconsin does not have strict processes in place to track blooms across the states. We just don't have a statewide monitoring program for HABs. It's not enough money, staff capacity to do that because we have so many lakes. But to understand, the distribution of blooms across the state and trends in them across the years, the Wisconsin Department of Natural Resources, aka Gina, Little Liberty, right there, she collects and analyzes bloom reports over the years. And photos and descriptions of these blooms, if you observe them, can be reported to the DNR HABs program, aka Gina, to DNRHABs at wisconsin.gov. Just some data from last year. So in 2024, 253 blooms were reported to the DNR from January to December. This is 45% more reports than in 2023. So Gina had a really fun summer last year dealing with those bloom reports. To better understand HAB-related illnesses and address them at the state level, Wisconsin Department of Health Services has a program called the Harmful Algal Bloom Illness Surveillance Program. Our goal since 2008 has been to prevent and manage HAB-related illnesses in Wisconsin, and we do this through surveillance, outreach, and epidemiological research. Wisconsin is pretty unique because it's one of the very few states where cyanobacteria and cyanotoxin poisoning is a reportable condition, meaning that anyone who is aware of a HAB-related illness is required by state law to report it to your local health department. Most HAB illnesses are actually reported first to the Department of Health Services via an online illness reporting survey on our website, or the Wisconsin Poison Control Center often receives reports of illnesses and then will send those over to us. The DHS, along with the DNR, will then help local health departments investigate and respond to these harmful algal bloom related illnesses. This is just a picture of our blue-green algae webpage at the State Health Department's website. At the bottom here is that link to report suspected harmful algal bloom illnesses, just for your reference. And then once we receive that health complaint, we usually follow up with that illness complainant or the animal owner. We ask them a series of in-depth questions about the nature of exposure, symptoms, health history, what the water looked like at the time of their exposure, if they have any pictures of the water while they're recreating in it. Our goal in asking these questions is to really figure out if their exposure and their illness could be from cyanobacteria or cyanotoxins, or if another cause was more likely. And so if we do this interview and we figure out that yes, their illness was related to cyanobacteria, cyanotoxins, we usually contact Gina and regional DNR staff and the local health officers to brief them on this illness. If the illness sounds like it could be due to cyanobacteria, and if water conditions are still representative of those at the time of exposure, Gina will work with DNR staff to collect water samples. These samples are then sent to the State Lab of Hygiene. Dawn Perkins is our microbiologist there. She analyzes the cyanobacterial cell counts and identifies them in the samples, and then she also conducts toxin testing. She'll send the results back to me and Gina. Me and Gina will take a look at these results, and then we will interpret the level of health risk present, and then work with local health departments to provide guidance on what sort of public health action could or should be taken based on the test results and also just the visual observation of the water. In Wisconsin, local health has the authority to post health advisories and beach closures based on either testing or visual observation of the water. These are some examples of what a local health officer might post. They might post a caution sign at their beach or send out a press release to their community about harmful water conditions. These are some other examples of signage that the DHS offers to local health. These are more educational based, and they help recreators identify harmful versus non-harmful conditions. If you are part of a local lake association and you're concerned with harmful algal blooms in a water body, whether there's an associated illness or not, you can work with the local health department to post these signs at your affected water body. So that is an option. Lastly, I do want to note that the state does not have standardized recreational guidance for exposure to cyanobacteria and cyanotoxins. And in this absence, we defer to federal guidelines. So the Environmental Protection Agency advises that a swimming advisory be posted if microcystin exceeds 8 micrograms per liter in the water body, or cylindrospermopsin, another liver toxin, exceeds 15 micrograms per liter. The World Health Organization also has some guidance. You can see the values are a little higher. It's a little less protective than EPA's guidance. But if you don't have means to test the water, visual observation of bloom conditions is usually sufficient to warrant beach closure. So Gina and I can usually tell based on a photo of the water what the level of health risk is and what sort of action should be taken to protect public health. And there are other methods of testing the water for health hazards and determining if a bloom is a health risk to the public. Tristan is going to talk a little bit about their beach monitoring methods and what strategies they use to test the water in Eau Claire. And with that, I want to thank you, and I will turn it over to Tristan.
That's okay. I will be quick. All right, thank you, Jordan. Good morning, everybody. My name is Tristan. I work for the Eau Claire City County Health Department. I'm a microbiologist there, and so I'm going to talk to you a little bit about our monitoring program for our public beaches in our county. For those of you who don't know where Eau Claire is, there we are on the map. We monitor 7 public beach locations throughout the summer. And depending on the location, we have 1 to 4 samples that we take at each spot. Our full route is about an 80-mile round trip. So our interns get a lot of windshield time, so they need a good podcast or a playlist of music to listen to. But usually they enjoy getting out there in the field. We have 2 categories of monitoring, and one being cyanobacteria or harmful algae, and then bacteria or E. coli. And really our goal is to reduce waterborne illnesses by limiting the use of beaches and just notifying the public so that they can make an informed decision if they want to swim or recreate at the beach during known times of contamination. And so Eau Claire has a pretty robust or unique program. Some other counties may not do any monitoring, or some may do less frequent monitoring. So it just depends on your county. So we have our beach monitoring season from Memorial Day to Labor Day. That's the peak time of usage from the public. So that's where we want to be out there, making sure that we're doing our monitoring and giving the public our information about what we're seeing. And so we are out there routinely once a week. And if we have elevated conditions of bacteria or algae, we are out there then daily. So we collect sanitary surveys. This is a survey from the EPA. We did edit it a little bit to tailor our needs in Eau Claire County. And then here we have a picture of back in the lab of all the samples, and those are being then set up for bacteria analysis. With cyanobacteria monitoring, in Eau Claire County, most of our harmful algal blooms are from July to August. They can extend beyond August, just unfortunately we don't monitor after Labor Day. And it is just difficult. There's no way to visually confirm that a bloom is producing toxins or not just by looking at it. So that makes it really hard for local health departments to know when to close a beach or post an advisory. So we treat every algal bloom as if it could be harmful, and we do that because we're trying to protect some of our most vulnerable populations, including our children, those who may be immunocompromised, or the elderly. And so what we do for routine monitoring is doing field measurements. We have an algae torch, and that will give us a chlorophyll A reading from cyanobacteria and a chlorophyll A reading from other microalgae present. So we get 2 chlorophyll A readings. And then we're doing that visual assessment of what does the beach look like. And again, we're rechecking it daily if we are noticing anything, or if we have an advisory or closure posted. And keep going quick here. So if we do have some visually, streaks in the water, globs, some evidence that looks like, okay, there is cyanobacteria in the water, maybe a bloom is starting to form, but not quite there yet. We don't have that scum layer, pea soup looking beach yet. So we would post an advisory to just let people know what to look for so that they can keep an eye out when they go to the beach, because we all know that conditions can change so rapidly, and by the time we may come back in a few hours or the next day, it's going to be completely different. So when we see these types of conditions, we do post that advisory. And then if we see conditions that look more like a severe bloom, so that there's a scum layer on top of the water and that it's covering pretty much the whole beach, that is when we would post a closure. That would suggest that there may be a greater risk of increased cyanotoxins. And so we realize the drawbacks of this, that you can't tell if it's producing toxins or not, but we just want to make sure that we're approaching that cautiously, and making folks aware that there could be cyanotoxins present. With bacteria, so we collect our samples every week and then processed at the lab. They do incubate overnight, and then we get our E. coli readings the next morning. And we use a most probable number calculation. So the bottom picture there is called a quanti tray. And so different cells will turn color if they have total coliform bacteria present, and then they will fluoresce if they have E. coli. And same thing with bacteria. We have our advisory. If that E. coli level comes back from 235 to 999 colony forming units, we would post an advisory. And we use E. coli because it's pretty easy to measure. There's no way to measure all the different viruses or bacteria in the water. So that is why E. coli is used as an indicator. When that level is high, there may be other things or viruses present in the water. And then we have our beach closure. Anytime a level comes above 1,000 colony forming units, we would post the beach close sign. For public notification, we have the physical beach signs. So we have large like sandwich board signs that are posted at the beach. We tried to separate that from the board of a lot of other signage at every boat launch or beach location to try and make it stand out a little bit for the public. And then we also post information on our website, social media, and then we also have people sign up for email notifications. That's a really common way for folks to get the beach status for whatever beach they're looking at. Some other common questions that we get from the public, is it safe to paddleboard, or what about kayaking? Or I have my grandkids coming this weekend, what about, them swimming off of the dock here at the cabin? So we really try to be a good, helpful resource and give them as many tools that we have to help them through that decision. In general advice, when in doubt, stay out. Don't go in if the water looks like it's an algal scum and you see, that pea soup appearance in the water. And then we also can give them information about the jar and stick test. This was a resource developed by DHS, and that can help determine if it is cyanobacteria or other algae present. And then for other outreach that we try to do, we have here a flyer about protect your pets. We give these to vet offices in our county every year, a big sign to post at their office. Sometimes it's about finding that trusted messenger to help get that information to the public, because not everyone may follow or hear our advice from the health department. So we try to find whoever is that trusted messenger. And then we have coloring sheets. We try to go out to community events and hand out crayons and coloring pages to kids. And then my favorite sign, don't feed the geese, save your bread, save the beach, because more poop will mean more beaches closed. And then also targeting waterfowl hunters. Again, in the fall, we know that blooms can persist beyond our monitoring period. So also try to do some education for that group. And also, we have a trifold there developed for people to be aware of animal safety. All right, thank you.
We got about 5-10 minutes for questions here. So any questions for these two? Go ahead.
Yeah, well, so the resources, the jar and stick test, that resource is online, if I remember correctly, on DHS's website and DNR. And so that's something that you could just take, a jar, a mason jar, and collect the water, and correct me if I'm wrong, either Gina or Jordan, and then let it sit, for how long? Okay, and just see if then the algae floats to the top of the water or if it stays at the bottom. And so if it floats to the top in the jar, then you know that that may be cyanobacteria. And then the stick test is like if you took a stick and dipped it into your algal scum and picked it up, and if it coats the stick like a paint appearance, that could mean it would be cyanobacteria or harmful algae. Or if it came up and it looked really filamentous, then that could be just other green algae. Yeah, that was a good question. So question about do we do testing for cyanotoxins and E. coli in our lab? So we don't do any testing for cyanotoxins. By the time, you'd take samples, send it down to the state lab that Jordan mentioned, we're looking at maybe a day or two later you'd get results. by then it's like, well, you're really going kind of retroactive of posting those advisories and closures. So really hoping that maybe someday I'll have a field instrument that I can just go out, take a sample and tell me if it has, you know, many different toxins in the water at that time, but we don't do toxin testing in-house, but we do all the E. coli.
And just to add to that, at the state level, we only have the ability to test water for toxins if there's an associated illness. We just don't have the money to test every water body for a toxin if there's a harmful algal bloom present. So that's just another challenge we face. And if people wanted to test their own water for toxins, sending it to the state lab, the tests are pretty expensive. So that's just another limitation that we face.
Go ahead again. Yeah, so asking about retesting strategies, are you asking for E. coli? Both. E. coli would be, we, typically routinely grab our samples on Monday if we're able, if it's not raining, collect those samples earlier in the morning to early afternoon. Unfortunately, that's another test that takes overnight. So we don't get results until the next morning. But normally we get them by 8, 9 a.m. and then we'd be going out the next day right away, grabbing new samples. So we try to get out there as quick as possible and get those samples set up as soon as we can. And then with algae, if we notice that there's a bloom or we post an advisory, post a closure, again, we would typically go out. Sometimes we've gone out twice a day, morning and afternoon. Does depend where it is in the county because it could take a long time to drive out there to some of our further locations, but at least daily, usually in the mornings, but sometimes in the afternoon as well. Yeah, a question about the algae torch. So we use that. It's a tool in our toolbox that we use, and really it usually corresponds with what we're seeing visually. So it, like I mentioned, it gives that chlorophyll A reading from cyanobacteria. So if levels are above a certain number, that we kind of drafted the number from the World Health Organization, that could suggest that there may be an elevated risk of toxins, but it's not for sure. But so we use that just to get a value, and it usually matches up. Like if we get a high reading, we're probably seeing that visually as well. And then, just using it also for data collection too. I hope that answers your question. Lake associations do with smaller lakes do to with more monitoring for harmful algae, correct? Really, it'd be visual, using your eyes and documenting what you're seeing visually at the lake. If Jordan has anything more to add to that, certainly feel free, or Gina.
Yeah, I would just agree with that. You can always take photos, definitely encouraged, and you can always send those photos to Gina at the DNR or the state health department or local health, and we can help you determine pretty quickly what your water conditions are indicating in terms of health hazards. So that'll be a good resource. Yep. And then at the state health department, we also have identification guides showing you what harmful algal blooms look like, and maybe some other common like organic matter in the water that could be mistaken for harmful algal blooms. So just resources for identifying harmful algal blooms are located on our website. I'm happy to share those with you directly if you'd be interested in those, but those will be very helpful.
I guess I just had another comment too, with the algae torch, we use it, but with the chlorophyll A readings, there is conflicting research and, information from the EPA. They don't correlate chlorophyll A readings with toxin levels, or they think that they had enough research to establish those relationships, but the World Health Organization still does have those. So the chlorophyll A component is a little bit of conflicting, information that you're going to gather, if that's helpful.
All right, another round of applause for Jordan and Tristan. Thank you so much.